Thanks to your help, I've been able to conquer my drug use, but now I feel like I'm replacing drugs with sex. I've watched porn before, but now it's like I can't stop. And last week, my boss found out that I was watching porn on my work computer at home and at work. I know I shouldn't have done it, and I didn't even enjoy it, but it was like I couldn't control myself. And now I might lose my job.
I'm so glad you brought that up today, Zach. I know sex isn't always easy to talk about, and this situation sounds really stressful, but we are going to figure this out together. Now, Zach, let me ask you this. Have you ever heard of sex addiction?
Addicted to sex? Is that even a real thing?
Well, Zach, although our understanding of sex addiction is still developing, yes, it is very real. There is a new and somewhat controversial diagnosis, compulsive sexual behavior disorder, which is recognized in the ICD-11, but not yet in the DSM. It's also been referred to by some as hypersexuality. There are two types of addictions, substance addictions, which you already know about, and behavioral addictions, such as sex addiction, gambling, or binge eating. I want to clarify that when I say the word sex, I'm not talking about what you yourself define as healthy sex, but really those compulsive sexual behaviors that you regret or that get you in trouble. This includes what you would define as compulsive masturbation, excessive cybersex or phone sex, relentless porn use, or even going to strip clubs compulsively, despite the consequences.
So, how do I know if I have a sex addiction?
Great question. Let's talk about the symptoms of compulsive sexual behavior disorder, according to the ICD-11. You unsuccessfully try to control sexual impulses or have difficulty reducing your sexual activity. You repeatedly engage in sexual behavior, even when there are negative consequences and you're getting little to no pleasure from it. Sex has become the center of your life, to the point where it's causing distress and you're neglecting relationships, responsibilities, and self-care. The distress you feel is not solely because of moral judgments or disapproval, and these symptoms last for at least 6 months. There are other signs too that aren't part of the official diagnosis, but are helpful to be aware of, such as you use sex as a way to escape or cope with hard emotions. You've built up a tolerance to your problematic sexual behaviors, meaning that you need more frequent or intense sexual activity to feel the same effect. And lastly, you may feel some sort of withdrawal, like you really need certain types of sexual behavior, despite it causing you problems, to prevent some terrible feelings coming up in you.
It sounds like I fall into a couple of these categories.
Well, that's something we're going to explore more in detail.
Okay, so what's the next step?
Well, now I'd like to go through a screener with you to learn more about your symptoms and figure out the best next steps. How does that sound?
Yeah, okay, that sounds good.
And Zach, I don't want you to worry. If we do discover that you have sex addiction, there are many treatment options and ways to cope with sex addiction.
I'm ready to get to the bottom of this, just like I did with my drug addiction.
It's interesting you should say that because these addictions often come in clusters. Many people with chemical addictions to drugs or alcohol also find themselves dealing with behavioral addictions, like to sex. In fact, the addictions often go hand in hand, with one reinforcing the other.
If you feel you may be experiencing sex addiction, there's help out there. There are free 12-step support groups, which are like Alcoholics Anonymous, but for sex. There's a few S groups out there, and you may want to read more about them. They include Sex and Love Addicts Anonymous, Sex Addicts Anonymous, and Sexaholics Anonymous. If you're a mental health provider seeking information on evidence-based treatment, check out our courses at psychhub.com.